From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Ciara Speller. On March 10th, Governor Charlie Baker declared a state of emergency, allowing the state more flexibility to respond to the coronavirus crisis and to receive federal help in procuring needs for medical supplies. Since then, thousands of people have been tested and dozens of people have died. Joining me today to discuss the current status of COVID-19 in our region is Dr. Andrew Ardenstein, Chief Physician Executive and Chief Academic Officer at Bay State Health. He's also a specialist in infectious diseases. Thank you so much for being here with us today.
My pleasure. Thank you.
And we know how busy you are at Bay State Health. As you know, you're on the front lines of this health crisis. So again, we're really grateful that you're here.
My pleasure.
My first question for you is, what is the current status of cases in your facilities?
Well, we're seeing a progressive and steady accelerated increase in cases and in positive test results from patients who are sick and coming to the hospital and from some of our employee health service work.
And so what are you hearing from some of the other hospitals in the region?
I think we're pretty much hearing the same thing. We're early in the pandemic locally, probably in week 2 or 3. We're certainly a few weeks behind New York and New Jersey and several weeks behind Washington and California, Washington State. But Massachusetts is another epicenter now, and Western Massachusetts is starting to see that incline in cases and a lot of sick people. I've been doing this a long time, and I've never seen as many sick individuals in one hospital with the same diagnosis.
Right. And so, we're seeing more and more of this now. Dozens of local companies and schools have been donating their unused PPE supplies. Has this been helpful at all?
We really appreciate it, and it has been helpful. I have to tell you that the numbers needed are insurmountable. We're talking about massive numbers of masks and gowns and pairs of gloves. What you hear on TV from our federal authorities at these national press conferences, we go through thousands of masks per day, and I mean thousands, and that's to take care of sick patients. They have to be changed between sick people. They have to be worn in other areas of the hospital, taking care of other patients. And we have a lot of staff members in a facility of our size and scope. We have over 12,000 team members who are involved one way or another in the care of patients.
And now we're also seeing local ski resorts. They're collecting ski goggles and they're cleaning them and they're sending them off to hospitals to, hoping that they can make a difference. What do you think about that?
I think it's very helpful. Everyone feels the need, and we thank them for contributing. We've actually issued goggles, permanent goggles and face shields to all of our frontline clinicians so that they can, and we've taught them how to appropriately clean them so they can reuse them and protect themselves. Our job is to protect the safety of our patients and our workforce. To take the best care of our patients, we need a safe and well cared for, talented workforce, and that's what I intend to do. I will tell you, we're in the United States in the year 2020. The fact that we're talking about shortages of masks and gowns and gloves and goggles, these have been in use for decades in healthcare. We shouldn't need to be talking about shortages in such things during a time of crisis.
Right. And so, with that said, how are your frontline personnel holding up physically, mentally? How are they doing?
That's a great question. I appreciate you asking that. Everyone is doing their best. People are scared, just like in the community. People are nervous and scared, and there's a lot of uncertainty. This is a once in 100-year event, I hope. Certainly it's been 100 years since the last event like this. And people are appropriately nervous, but the truth is our 12,500 team members here at Bay State Health, and I think probably throughout our nation, the healthcare workers, this is what they do. They step up in times like this and do their best and use all their skills to bring to bear on the care of patients. They're compassionate people. This is a tough time, though. They're also humans. They have families. They have loved ones. They have their own health and others to worry about, and they have very sick patients. And because of things like reduced visitor policies, which are necessary to take care of, prevent transmission of the infection within institutions, a lot of these folks are also more alone than usual. So there's some loneliness also related to this pandemic.
Definitely. And now the governor has allowed for the relicensing of retired healthcare workers in good standing. I also have a friend who joined a COVID-19 relief team, so she was able to expedite her RN license. Are you starting to call for help? Are you seeing any, retired workers or people expediting their RN licenses helping out?
We certainly have begun to explore those areas, not just with nurses, but with other professionals. I know that, for instance, the UMass Medical School, which we're the regional campus of at UMass Medical School Bay State, they graduate early, some of their residents, as do we, so that they can become full-fledged trained physicians a few months earlier to enter the workforce. We've accelerated, the state of Massachusetts and federally has accelerated the licensing process of professionals to allow them to be deployed to good use. And we've had a lot of good contributions from community professionals who are interested in helping in whatever way they can. Sort of what you were talking about with donations of personal protective equipment. We've also had, and I use quotes, donations of professional talents, people who want to bring their talents to bear. And there's lots of work to go around for everyone, not only the work that's going on in the health systems and in our hospitals, but in the communities, because a lot of these patients will be discharged from hospitals, I hope, getting better, but they're not going to be able to go home because they're still going to need ongoing health care. They will need to be in facilities like nursing homes and subacute nursing facilities and long-term care facilities in some cases to allow them to fully recover. And those also need to be staffed. And right now we're in crisis mode pulling staff into hospitals, but these other facilities will need that as well.
All right, and we'll continue our conversation after the break. You're watching 22 News in Focus. Welcome back now to 22 News in Focus. Today, we're talking about the medical impact of the coronavirus with Dr. Andrew Ardenstein, Chief Physician Executive and Chief Academic Officer at Bay State Health. So here at 22 News, we've received hundreds of emails and calls in the past few weeks from viewers who are confused about prevention and testing protocols. So Dr. Ardenstein, who's getting tested?
Well, right now, and I can really just speak to our region, I can't speak to nationally. Right now, we are only testing symptomatic sick individuals who are in our hospitals or who come to our hospitals and employees with symptoms. We are testing some limited first responder groups that directly apply to Bay State Health. And we have plans to expand testing, but we're really limited at this point on the availability of the basic parts of testing, the swabs that you use, the liquid that the swabs get put into to get transported to the lab, and the reagents that are used to run the tests themselves. We have been so limited now for weeks in this. It's improving somewhat, but we still have limits, and those limits are not under our control. They're under a much larger, broader national picture. So testing is still extraordinarily limited, regardless of what you may hear in the national news. That's the story.
All right, and let's talk about when someone should consider getting tested.
Well, if someone has symptoms severe enough that they need to be hospitalized, they will be tested. At Bay State Health, we've tested about almost 1,800 people over the last several weeks, almost 1,800. But that's a relatively small number compared with the number of people out there who probably have this infection. It's just most of them have mild or no symptoms.
Okay, and how long does it take to get those results once someone is tested?
Well, if you asked me a week ago, I would have told you 5 to 7 days. As it stands today, we're within 24 to 48 hours for most of those tests, and we're really happy about that. But I'll be honest with you, I would like to be able to turn those around in hours, and our laboratories could do that if we had all of the other supplies I told you about a few minutes ago.
And what happens if someone tests positive? What's the next step after that?
Well, so if they test positive, again, because we're limiting our testing to people with symptoms, many of whom are in the hospital and many of whom aren't. And if they test positive, really nothing happens unless they are hospitalized. But if they test positive, they're obviously the decision is made whether they are sick enough to be in the hospital. And again, only a small percentage of those, maybe 15 to 18% of the patients, will need to be hospitalized. The vast majority of them stay at home. And they're told to stay at home, take care of themselves with fluids, with rest, with symptomatic relief. That may mean Tylenol or things like that. And to try to stay as isolated from other folks, because you want to try to limit transmission. So we really try to keep people isolated to the extent at all possible. And most people will recover with that. There is no, as you know, as I'm sure your viewers know, while there may be a lot of optimism about potential drugs in the future, there are no effective treatments for this today other than rest, fluids, and let your body come to its own defense and recover.
Okay, and when should someone be admitted to the hospital?
Well, that's a complicated question because there's a number of reasons why someone might get admitted. Most of the patients who end up needing hospitalization that we've encountered are people who cannot adequately get enough oxygen into their lungs. In other words, they're short of breath, and when you test their oxygen levels, which we can do, their oxygen levels are too low to get by without supplemental oxygen. So they need to come in to get treated. In some cases, they need pretty heavy doses of oxygen. That's really been the main issue. There may be other reasons why you need to be admitted. If you're unable to take any fluids, hold anything down, you may need to be admitted to get fluids. And there are sometimes other reasons, especially people who have other medical conditions that may be made worse by this infection. If you have heart disease or lung disease already, it can sometimes get a lot worse when you get any viral infection, and this one is a particularly bad one.
And so at your hospital, is there an isolation unit, and are all COVID-19 patients who are positive moved to that unit?
There's not a single unit. There's multiple areas in the hospital where we can isolate folks with any number of different infections that require isolation. And before we know what someone has, we frequently isolate them until we do know, because again, there are multiple different infections. Right now, obviously, the whole country is focused on this one infection because this is where most of the patients are suffering from. This is the particular illness. And so we're able to isolate in a variety of settings. Obviously, we, like most other health systems and hospitals, you try to what we call cohort people. That means put people with similar diagnoses, like coronavirus, in similar wards, because that's where we have the most highly trained staff who can take care of them. And that's also where we can concentrate the airflow in such a way that it's isolated to the rest of the hospital. And we can also concentrate the supplies. Again, we're in a high shortage time of personal protective equipment. We want to make sure that is delivered to the places that need it most in the hospital, which is these patients and the care of them.
Right. Okay. So we're also wondering, has it been determined that once someone has tested positive for the illness that they're immune after that?
Well, it's a great question. And in order to be totally honest with you, I have to say it's not clear. We don't know yet. With most other respiratory viral infections, when you get a particular strain of infection and you recover from it, you have some level of immunity for some duration of time. It's different with most different infections. With this infection, we just don't know because it's brand new in society. Really, this is the first year we've encountered this particular virus, this particular strain. Even though it's in a family of viruses we're familiar with, this is a different member of the family, a particularly bad actor member of that family. And so we don't know. So the answer is unknown at this point. And we don't know how many people actually have immunity because we don't have the results of any blood tests that have been done on a large scale in the community. In any community, that means Italy and China and Spain and Singapore and South Korea, all of the other countries that have experienced this and continue to, we don't have those results either. So we won't know that probably until many months down the line.
Okay. All right, thanks, Doctor. When we return, we'll be discussing prevention and the outlook for the end of this health crisis. You're watching 22 News in Focus. We're back here now with 22 News in Focus, and today we're talking about the most recent developments in the COVID-19 crisis in our region. We've heard a lot about flattening the curve. So, Dr. Ardenstein, what is the curve and where are we on it right now?
Well, the curve is the curve of cases. It's the trajectory of cases in an epidemic, and where we are is probably in the third week in Western Mass of what will probably be somewhere between a 6 and a 10-week total curve. That is, it's sort of like a roller coaster. You go up and you come down, and how long you stay up depends on, in this case, how good we are at physical and social distancing that you've heard so much about. That can really reduce the curve, flatten it out. It won't stop us from having this epidemic or pandemic, but what it can do is reduce the highest peak and make it last a little longer. That may not sound like a good thing, except when it comes to hospital capacity and healthcare capacity, we can work through this as long as the surge is surmountable, as long as we don't get inundated all at once. That's why flattening the curve is so important. It also allows people in the community who come into contact with the virus who are not that sick to develop immunity. The more people that develop some level of immunity in the environment, the more herd immunity there is, the better everyone does, because there's a little protection floating around the environment.
All right, and so once the disease is on the decline, should we still maintain the current safety protocols?
We should maintain them for as long as possible. At some point, we'll be able to relax them somewhat. Actually, the idea of physical distancing, I call it that instead of social distancing, because the actual issue here is physical space that you've heard so much about, those 6 feet of space. The idea of physical distancing, that works. That's been proven in other epidemics to work, and it has been proven already in the state of Washington, for instance, to help them flatten their curve a little bit. It worked in South Korea. It's worked in China to help them get over the peak. It does work, but it's hard to do, and it's hard to do in a free society like the United States, where people, we love the idea that we are free and we can come and go as we please. This is a time, though, where we really need to be very serious about this to try to get an effect to help us all.
Baystate and other hospitals have been releasing information about test results in confirmed cases every day. And the numbers so far have shown that a large majority of those tested were found negative. So is this good news in your opinion? And do you think that cases will continue to grow in our region?
I think they will continue to grow. I think first of all, as more testing goes on, we'll get more results. And as it gets into the community, that would be a good thing. We're not there yet, probably a week or two, I think. The second thing is that there'll be more positive tests simply because there's so much virus most likely transmitting in the community. It's pretty widespread, we think. We don't know, because the only way to know would be to test a lot of people, and we haven't done that in the United States except in very isolated areas like New York and New Jersey now. There's been a lot of testing, but until this time, there hasn't been enough testing to really get a sense of just how widespread it is. You've heard Dr. Fauci and other national experts saying that if we had really tested a lot of areas, especially areas that aren't quite hotspots yet, but that could be hotspots, that are on the rise, those are the areas you want to know how much virus is out there. I think Western Mass, there's a fair amount of virus, just like there is throughout Massachusetts, frankly, and throughout New England and elsewhere, circulating in the community. Again, the vast majority of people will have few symptoms and recover fine. Some people tend to get more sick, and some of those people require hospitalization, and some of those require critical care, which you've heard so much about. The idea, though, is to test, isolate, physical distance, even if you're not tested, but just to stay healthy and to prevent transmission among different people, and to ride it out a little bit. But it will be somewhat painful in the interim, because we're going to have to do things we're not used to doing.
Right, so doing things that we're not used to, like you said, quarantining on a national scale is something our country hasn't seen in 100 years. So for all those, people at home who are now working from home, learning from home, their daily routines have totally changed. What would you say to them?
I would say you're doing the right thing. You can still be very productive. Many people, not everyone, but many people can be extremely productive working from home. In our healthcare organization, we've gone through the list, and we have a number of people working from home. Again, we have a lot of people who provide direct care of patients. You can't work from home in that situation. All we can do there is be very, very careful about the safety and health of our workers and keeping people protected, which I'm sworn to do. That's one of our responsibilities as leaders in healthcare systems, protect our people. And it's hard because the supplies are not directly in our control, but we're making the best of it. But in terms of the people out there, I would tell them, keep doing what you're doing. It is hard. It's hard for all of us. We're all humans. We're used to social interaction. That's one of the things that makes life worth living. This is temporary. It may take a month or 6 weeks. It may take 2 months, but it will eventually recede. The dust will settle. We'll pick up the pieces and we'll be back. But right now, this is what we have to do. I concur 100% with our state and national authorities in that.
All right. Thank you so much. And we'll have the last word after this next break. You're watching 22 News in Focus, and today we've been talking about the latest developments in the coronavirus crisis here in Western Massachusetts. I want to thank Dr. Ardenstein for joining us today. I know how busy your schedule is. We can't thank you and your staff, all healthcare workers and people keeping us safe, as well as essential workers out there during this tough time. So thank you again so much for doing this and for doing everything for everyone out there.
Thank you.
And thank you to you at home for watching. If you missed any of this episode, you can find it on our website at WWLP.com. From all of us here at 22 News, be safe and stay well.